everyone, it's Dr. Cindy here at Horizon Dental. February is Kids Oral Health Month. So to celebrate, we've shot a little video showing you what you can expect from a typical child's dental cleaning and checkup. A huge thank you to our wonderful patient Rya and her fabulous hygienist Natalie for letting us shoot this little video. We hope you enjoy.
So the first thing we do is come out into the lobby to greet our patients and their parents. We want to check in and make sure there's been no changes to their medical information, ask if they have any dental concerns, and make sure their parents are all right with us taking X-rays and using fluoride. Next, we want to get our patients settled and comfortable in the dental chair. We give the kids a chance to pick out their favorite TV show so they have something to look forward to while we're cleaning their teeth. We also do a check-in with the kids to make sure that they don't have any questions about the appointment. And then it's time to get started. First, Natalie is going to start by taking some routine dental X-rays on her patient. This way, she's ready for me to come and do an exam anytime during the appointment. For most kids, we like to have 2 dental X-rays to screen for cavities, usually every 6 to 12 months, depending on their individual needs. For kids who are too small for these intraoral X-rays, or if we need to check on their growth and development of their permanent teeth, we might take a larger panoramic X-ray. We will also take additional X-rays to see the roots of the teeth if we have concerns about infections or investigating trauma. At Horizon Dental, we use digital X-ray sensors to send our images immediately to the computer. We will always protect all of our patients with a lead apron and a thyroid collar, even though the amount of radiation from digital X-rays is extremely low, and they're very safe, even for kids. All of our patients are given sunglasses for eye protection and a dental apron in case the spit ends up flying, which it inevitably does. Natalie, of course, is going to put on all of her personal protective equipment, including her mask, gloves, and face shield. Some of the older kids and most adults will be asked to rinse with a basic mouthwash before they're cleaning. This helps reduce the amount of bacteria and viruses in their saliva. We find that this is an important step in infection control, and it only takes about 30 seconds. Then our patient can just spit into the suction. Natalie's next step is to do a dental prophy or prophylaxis using one of our spinning dental brushes. This will remove any soft surface plaque and surface stains. It gives her a better look at the teeth and the gums while removing the largest amounts of bacteria. Some hygienists will choose to do the prophy at the end of the appointment, but it's only a matter of personal preference. Honestly, I think my favorite part of the dental cleaning is the prophy, and kids love getting to choose their favorite flavor of polish. My personal favorite is cookie dough. Natalie is also choosing to floss her patient's teeth at this point to check on the teeth, evaluate her fillings, and how well her patient is flossing at home. It'll take a little extra time for her to floss around that lower orthodontic retainer, but it's worth it. Now Natalie is getting ready to use the ultrasonic scaler or cavitron. This vibrates at a high frequency and uses water to remove any hard tartar deposits from the teeth. In our office, we also use a high-volume evacuator attached to a mirror so the hygienist can see more clearly, reduce the saliva and water buildup, and eliminate any aerosols generated during the scaling. We don't always use this tool on children, but some people build up tartar around those teeth a lot faster than others, and the ultrasonic scaler is a great way to remove those deposits quickly and comfortably. Of course, hand scaling is always an incredibly important step in any dental cleaning. We use these small tools to refine any areas, remove smaller deposits of tartar, and make sure that there's nothing left on those tooth surfaces that might irritate the gum tissue. Most kids will only need a few minutes of hand scaling to remove tartar, typically around the lower front teeth and the back molars where it's hardest to reach. Unlike adults, most scaling is needed on children above the gum line instead of below the gum line on the root surfaces. The time we take to do the hand scaling is also a great opportunity to do some education and let kids know where they might need to improve some of their brushing habits and pass along any tips and tricks we think that they're going to find helpful. We also take this time to review things like their diet and other habits that might be contributing to gingivitis or cavities. Now that Natalie's all done, she's going to go and get the dentist. In this case, yours truly. I really enjoy checking in with all my patients, especially the kids. I like to ask them how school's going, what they've been up to, how their siblings are doing. My exam is going to involve checking the teeth and the gum tissues for any concerns like cavities or infections. I'll take the time to check around the edges of any fillings they might have, and especially focusing on the more common places to get cavities, like in the grooves of those permanent teeth. Natalie and I will update the patient chart next and come up with a plan to fix any problems that they might have, like planning out fillings to fix cavities. Then I can let our patient know what I found and ask if they have any more questions for me. One final check of that orthodontic retainer, and our patient should be good to go. I'll let Natalie know how many fillings I need to do, how many appointments it will take, and any other suggestions that I have for our patient's parents. Now that we're at the end, our final step is to apply a fluoride treatment. For most kids, we're going to use a fluoride varnish, which is going to help keep those teeth strong and cavity-free by promoting remineralization of the enamel. Finally, Natalie can take her patient back out into the lobby and do a checkout with Mom to let her know how the appointment went, if we found any cavities, or if there's any other concerns. She'll help Mom book the next appointment, whether that's to have any dental treatment done or if it's her next cleaning or checkup in 6 months. And that's a typical dental cleaning for kids at Horizon Dental. Thank you so much for watching. We really appreciate it. Make sure to hit that like and subscribe button for more fun and educational videos about dentistry.